Hello, we are Lina and Kira, and we're gonna explain lung cancer. Lung cancer is a malignant tumor originated in lung tissue. That is to say, it is initiated in the lung, not a product of metastasis of other tumors.
In order to maintain the right levels of carbon dioxide and oxygen, the body needs to breathe in and breathe out. This process is called ventilation. Since gas flows from high to low pressure, the body must create a pressure difference between inside the lungs and the atmosphere in order to ventilate the lungs. During the inspiration phase, the respiratory muscles contract, allowing the thorax to expand and the intrapulmonary pressure to decrease, so the air can get into the lungs. During the expiration phase, the respiratory muscles relax, allowing the thorax to get smaller and to increase intrapulmonary pressure so the air can go out the lung. Scenario: Jean is 52 years old. She has smoked 12 to 15 cigarettes per day for 20 years. Now she refers dyspnea, chest pain, and coughing up blood. Let's figure out what's going on with Jean.
Risk factors. Exposure to these risk factors can cause lung cancer. Genetics. Studies suggest that mutation of P53, which is the tumor suppressor gene, increase the risk of lung cancer. Environmental. Exposure to asbestos, metals like arsenic. Cigarette smoking is the principal risk factors. Exposure to secondhand smoking may also cause lung cancer. Cigarette smoking is the most significant contributor of lung cancer because both promotes and initiates carcinogenesis, which means beginning of abnormal cell growth. Cigarette smoke causes DNA mutation and also causes irritation that signals cell repair. However, due to the DNA mutation, cell repair is not done properly because the newly developed cells are undifferentiated, so they can't carry out their functions. Eventually, because chronic cigarette smoke exposure, those undifferentiated cells accumulate and overgrow, leading to a tumor.
The tumor alters pulmonary ventilation because the mass causes airway obstruction. This obstruction increases the intrapulmonary pressure, which means that in order to breathe in, the respiratory muscles need to work harder to create a pressure difference between inside the lung and the atmosphere. Thus, due to the increased intrapulmonary pressure, the volume of air that enters during the inspiration phase is smaller, which leads to hypoventilation, hypoxia, and hypercapnia. Coming back to our scenario, Jean was diagnosed with non-small cell lung cancer, which, according to the cell type, is subdivided in three types. Adenocarcinoma, commonly found in the edge of the lung and may involve pleura. Large cell carcinoma tend to grow quickly and spread. And the third type is squamous cell carcinoma, commonly found in the middle of the lung from squamous cells that line inside the bronchi. Symptoms include dyspnea, which is due to the airway obstruction, chest pain. Tumors like adenocarcinoma that involves pleura cause chest pain. Hemoptysis. The blood comes from the new vessels created by the tumor, which are leaky and easy to rupture.
Treatments can be different for lung cancer patients according to the stage of disease, patient's overall health, and preference. Options are chemotherapy, surgery, and radiation therapy.
To conclude our scenario, Jean was diagnosed with adenocarcinoma, a subtype of non-small cell lung cancer. She is now receiving chemotherapy. In summary, we have explained non-small cell lung cancer, which is just one type of lung cancer. Key concepts: lung cancer alters homeostasis because the tumor decreases ventilation due to the airway obstruction, which leads to hypoxia and hypercapnia. Proteins. Alteration in P53 gene leads to DNA damage and cells dividing and accumulating in an uncontrolled way. Cell membrane. Cancer cells have altered structured cell membrane which impedes cell-to-cell communication.